The history of the villages of Warokwi in Burkina Faso and Wanyan in Mali represents a case study which will remain engraved in the memories and the annals of the successful integration and cohabitation history between populations of different African countries, which common ambition remains the economic development and the social welfare. Warokwi is a village of the department of Djibasso with about 1,026 inhabitants and is located 15 kilometers north Djibasso at the Mali side. The department of Djibasso is under the control of the Kosi province and is located 65 kilometers north of Nuna. The township of Mafune was created in 1998 following the decentralization policy initiated by the Mali government. In 1991, it was located in the Tominian Circle in the region of Ségou. The township of Mafune is located southwest to Burkina and northeast to the township of Mandiakwi, a few kilometers from Wanyan in Mali.
Baluba mukutani Yivyatanayo Avalokocha Mope biase Banino badavanu Bukbalamu iba
The Burkina Mali Cross-Border Health Center is nowadays the first reference tool which unites two peoples, which history in a recent past was an ordeal with multiple consequences which nearly undermine the peaceful cohabitation between Burkina Faso and Mali, two neighboring countries which maintain long-standing relationships.
L'exploitation des ressources naturelles partagées.
The exploitation of shared natural resources is subject to conflicts between populations from Burkina Faso and those of the neighboring countries. The Kosi province unfortunately does not escape this reality, especially after the demarcation of the border between Burkina Faso and Mali. This demarcation did not necessarily take into account the traditional usage of the natural resources which were exploited by these border populations. Thus, in our province, we register cases of conflict. The most illustrative example of these unfortunate conflicts was registered in 2006, a dispute between the village communities of Wanyan, which is under the jurisdiction of the Republic of Mali, and the populations of the village of Warokwi, under my jurisdiction. The conflict unfortunately has claimed many casualties. After these unfortunate clashes, a monographic study was conducted in the two villages in 2009, and the diagnosis revealed that the populations were keen waiting for the realization of a sanitary infrastructure. Thus, the realization of the center that the populations were keen looking for has been made effective thanks to the financial support of the German cooperation and the willingness of the governments of Mali and Burkina, which were looking for strengthening the sanitary coverage of the border areas. Initiated following a request from the populations, the Burkina Mali Cross-Border Health Center remains nowadays the rallying point for the inhabitants of Warokwi and Wanyan. Better, the administrative authorities having jurisdiction over the two villages congratulate themselves for the outcome of this initiative, a first on the African continent. The project had not existed, it would have had to be created or invented. Merely have a look in the yard. Today we have women from Wanyan, Warokwi and women from other villages of Mali and Burkina Faso in the health area who are gathered. This is a proof that the project is very successful. The project meets a real need as the women are around for prenatal consultations and health cares. As you know, the place is very isolated and we feel that there is a need here. The center addressed this need I can confess that the notion of border is almost erased between the two localities. As far as I'm concerned, if all along the border between Burkina Faso and Mali, we succeed in establishing such an atmosphere, I can confess that it is all about development, and it is the best cooperation formula that we can stimulate. Once people interact, work hand in hand, I believe that it evacuates all the disputes all along the borders, and it strengthens the social, historical, geographical, and blood ties of the populations on either side of the borders.
Nous l'avons apprécié avec beaucoup de joie.
We enjoyed a lot the center. It's a project which works for the establishment of peace in the sub-region, especially between Wanyan and Warukwi. Although the two villages disagreed in the past, we note that the center is frequented, which really shows that there is now peace.
Quand le projet est arrivé, le projet a installé des banques de céréales.
When the project came, they first installed cereal banks, which allowed the two populations to fight against poverty. The project organized study tours, during which the two communities met and discussed. The project also organized diagnostic workshops where communities of my commune and those of the other commune exchange on their future. Today, the health center is also created by the project and has provided a mixing framework for our populations. So I can say that the project actually brought peace. Realized thanks to the financial support of GIZ, the International German Cooperation, the Cross-Border Health Center was designed to help beneficiaries have an accessible infrastructure with amenities for proper care. Equidistant between the villages of Warukwi in Burkina Faso and Wanyan in Mali, the center undermines boundaries due to its geographic location and its reception conditions for patients' proper care.
Le centre de santé transfrontalier Warukwi-Wania.
The Warukwi-Wanyan Cross-Border Health Center, as its name suggests, is located on the border between the two countries and is co-managed by the commune of Djibasso in Burkina Faso and the rural communes of Manjakwi and Mafune in Mali. When you get to the cross-border center, you have a first care service. So you have a dispensary unit, a maternity ward, a pharmaceutical unit, and a unit of expanded immunization program. Regarding the dispensary, we receive all first-level care, especially the patients. There is consultation, there is at least support for common lesions. The maternity ward takes care of mother and child. We have the monitoring of pregnancy, the deliveries, the promotional cares like family planning, children monitoring, that is, the consultation of healthy infants. There is also postnatal consultation, that is, when the woman delivers, she must be back 6 and 42 days later for the care.
Une semaine après, c'est-à-dire 6 jours et 42 jours après pour sa surveillance.
Since the creation of the Burkina Mali Cross-Border Health Center in 2012, about 200 births have been registered. At the maternity ward, women benefit from a regular monitoring of the pregnancy until delivery.
La maternité, elle est bien fréquentée.
The maternity ward is well frequented by women, with at least 5 women per day per delivery. The postnatal consultation is done every working day. In addition to the postnatal consultation, we have promotional activities. Everything goes well between women from Warukwi and Wanyan. Some women from Warukwi are married in Wanyan, and some Wanyan are married in Warukwi. As the manager of the maternity ward, I'm happy to the situation. I'm happy to be in between, as I'm among my relatives.
Beyond the monitoring of the pregnancy until delivery, children are regularly vaccinated as they benefit from the expanded immunization program. Compliance with this provision is intended, among other things, to to provide an alternative to the reduction of neonatal and children under 5 years mortality. Women who actively participate in the campaigns welcome this windfall, which is offered to them for their children's welfare.
I am very happy for this center. Sometimes pregnant women have to move to other areas for delivery. Now, deliveries are done here. The center helps us a lot. Besides, patients who are brought to the center recover from their disease, whatever it is. So I am happy and I am most grateful to you. I'm very happy for the center. It's very helpful in terms of health care. The center helps our children as we get them vaccinated regularly. Mother also gets themselves vaccinated regularly. Pregnant women come here for care and we provide them with drugs. I'm very happy and I thank you a lot. When I was pregnant, I came here for the monitoring. Later, I delivered here and I came across no difficulty. The fact of building the center here helps us a lot. Sometimes, some patients are brought in the center and whatever the gravity of their illness, the doctor do their best to cure them.
In addition to the maternity ward and the dispensary, the health center has a pharmaceutical depot. Drugs are made available to patients at lower costs. The patients who come to the depot have almost all the drugs that they have been prescribed. The prices are affordable as they are subsidized. We supply ourselves at Nuna and Tuminyan. The problem we encounter is the accessibility, as getting to Nuna or Tumanyan is difficult. Since the effective start of the activities of the Burkina Mali Cross-Border Health Center, the populations appropriated the infrastructure, hence the satisfaction of the head of office of the health center. Since its opening until today, we are pleased with the attendance of the center. When we compare it with the other services on either side, that is the health and social promotion centers in Burkina and the community health centers in Mali, we can say that we are satisfied because we have an average of 422 consultations per month. This is really a great thing. If the figures are encouraging on the attendance rate of the health center, this is due to the importance that the nationals of Warokwi and Wanyan, with no distinctions attached to the structure. This cross-border center has brought to the two villages, mostly to the two countries, cohesion. Things have changed compared with what we experienced in the past. We have this new center, which is near and at our disposal. People are around night and day while they were obliged to cover important distances for cares in the past. So I'm really happy with the center as it is situated in our locality and it brings us a lot. Since the creation of the center, people from the villages in the intervention area come for health cares and they encounter no problem. Patients who come in the health center are cured without any problem. When we sensitize people in the villages, we expect them to say that they are really happy with the center. We are really happy because with the presence of the center, distances are reduced in some villages. In the past, villages of Burkina in the area were part of the health center of Sinekwi. And it was a bit difficult for villagers to get quickly there with patients because of distance. With this center, things are easier because patients can be brought in with no difficulty and they are timely treated. The Burkina Mali Cross-Border Health Center, which is the pride of the beneficiaries, bring closer nowadays the inhabitants of Warokwi and Wanyan who met there on a daily basis. The structure, which employs 10 persons, is co-managed by the nationals of the area with an equal distribution of all the posts. Beyond the Burkina Mali Cross-Border Health Center, the African Union Border Program also intervenes in other sensitive fields for the welfare of the populations. Cereal banks have been realized in order to overcome any lack of food, even during the lean season. We started the cereal bank with about 2 million CFA francs, and today we increased it to 3 million CFA francs, which means there's a change. Regarding the cereal bank, many villagers get provided in the storehouse. We do the shopping during harvests and we sell in May, June and July. We set the prices with the villagers. The General Assembly set the prices and we stick to these prices during sales. While allowing the populations to have stocks of cereal for the future usage, the African Union Border Program, in order to increase the agricultural productions, has initiated a training project for the benefit of the farmers. 30 men and women have already participated in capacity building sessions in Benin on agricultural entrepreneurship, and the results are tangible on the ground through testimonials. The trip to Benin Republic was really successful. In the past, I operated in a wide space. Today, I exploit a smaller space, but I actually earn more compared with what I usually harvested. Nowadays, I can harvest 400 tins of peanuts per hectare. When I made it back from my trip, I shared what I learned with all the villagers. I am confident that the knowledge is vulgarized